The factors that influence the culture, then, if we want to think about how to manage it, are lots of things to do with management. If you were following any of Deepwater Horizon, you may have seen one or two television reports on the senior manager in that particular case. And in oil companies, which are very hierarchical, CEOs and senior managers can have a very powerful effect on the culture, because there's a very strong and direct and clear hierarchy there. But if we look in healthcare, I think you see a slightly different cultural pattern around leadership. So you see people who, in some cases, may be in nominal roles as leaders, but you also see very powerful leaders in other parts of those organizations who may not have these particular leadership titles, but are having very strong influence on the culture. Senior doctors being one particular group in question. And so we can look a little bit, I'll just take a minute or two to just say a couple of things about an area we've been working in, which is looking at the operating room with these kind of tools we've been developing and thinking about some of the behavior patterns and maybe some of the culture that happens in that particular environment. What's interesting about domains like operating theatres is that in big hospitals, they don't have consistent teams, so the team changes out, so there's different people there. So the culture almost has to be re-established on a daily basis, on a shift basis, and this is what they do in airlines. And there's some nice work going on here by Yan Chow at Baylor, looking at how that can be done by surgeons at the beginning of the list, at the beginning of the shift, setting the culture. And why you might want to do that is that there's some studies emerging now about the culture in operating theatres and how when leaders, as Edmondson pointed out last year, when leaders, surgical leaders, behave in appropriate ways and create the right culture, then they get a better learning organisation. They get people learning new techniques faster, being more comfortable speaking up. But there's also data around about the quality of team working in operating theatres, which is not always complementary. And these are some data we have for Scotland, where people seem to prefer working with the consultant anaesthetists than with the consultant surgeons. There's also some interesting data emerging from ICUs and operating theatres in the UK about aggressive behaviour or rude behaviour in the workplace. And these are data from a survey, again, in England, where both nurses and consultant surgeons seem to be being rated here as having given other people aggressive or rude behaviour. Now, why is that important for safety? I'll just take a minute to say here what I think the linkage is, or one of the reasons that this is important. One reason is that these behaviours can create a sort of reinforcing culture. Lorelei Lingard, who's a Canadian researcher studying operating theatres, doing ethnographic work, found there were times of tension in the operating theatre, and these particularly affected the novices. These are like trainee anaesthetists, trainee surgeons, maybe trainee nurses as well, who responded with behaviours that may intensify rather than resolve. So they're then behaving in a way that's making it worse. And this continues to reinforce what's not a very safe culture. There's some nice work, American work, I've come across recently in the social psychology literature about the effects of witnessing rudeness that I think is pertinent here. And these are laboratory studies, so I'm sure you're not normally reading the Journal of Organisational Behaviour and Decision Processes, but this was where this particular study was. These researchers had been studying the effects of being the victim of rudeness and found that had an impact on people's cognitive skills, which is not really surprising because it's a bit distracting. It's emotionally arousing if somebody's rude to you, so it could take your attention off your task. But in this new study, they've set up a paradigm that allows them to look at the effects of people witnessing rudeness. So this is an experimental study. They've got two groups of undergraduates. They're recruited to take part in a study where they just fill in some personality tests and some cognitive tests. They're in their test setting, and for one group of them, a confederate, a student who's part of the experiment, arrives late to take part and then is spoken to rudely by the person who's running the study. They say things like, "What is it with you? You're late, you show up here. How do you ever think you're going to get a job in the real world? You can't take part now in this experiment. So they're not particularly aggressive, but they speak to them quite sharply and quite rudely, and then they dismiss them. And clearly the other students have all been watching this little interchange between the experimenter and a fellow student. And what they found in this study is that the students who had witnessed the rudeness, nobody was rude to them, but they just witnessed a rude, slightly aggressive interchange. The students who witnessed the rudeness performed significantly worse on the cognitive tasks than the ones who hadn't seen this. And so their data are showing that just simply watching a rude or aggressive interchange might interfere with cognition. And that's why when we start to look at the culture and maybe look at behaviours that are aggressive or behaviours that are not supportive, we have to think, what's this doing to other people in the team who may be counting swabs or counting instruments or trying to remember to give a drug in 5 minutes' time? There can be distracting effects, emotionally arousing effects that can be very difficult for safety. So, diagnosing your safety culture then can be done in lots of ways. There's all kinds of questionnaires there. We've reviewed them recently. They tend to be measuring pretty much the same kinds of things. Most of the ones that are used frequently have fairly good properties. So if you want to know more about your safety culture, you can use one of these questionnaires. This is not entirely going to protect you, of course, as an organisation, because it is interesting in the Deepwater Horizon report to read that they did a safety culture survey about a month before the rig blew up. And there were some findings in there about 46% of crew members on Deepwater Horizon thought that some of the workforce feared reprisals for reporting unsafe situations. Most of these things you see in safety culture surveys are kind of under-reports, and 15% felt there were not always enough people available to carry out the work. There are often messages in safety culture surveys, important messages about things you need to be dealing with as an organisation that managers need to be addressing. And many companies now use these, particularly in the oil industry, use these regularly to sense the safety culture. So, where do we go linking safety culture to simulation? Nearly forgot the subject of my talk there, having distracted myself. The slide here is a little bit from left field, but I recently, having spent many years teaching people that the capacity of working memory was 7 chunks or bits of information, and if you're reading some old book on psychology or your situation awareness lectures for your non-technical skills course are not quite up to date, the answer is not now magical number 7, but it's magical number 4, which I think to many of us makes more sense. There's about 4 things at most, 3 to 4 things you could hold in your head in consciousness at any one time. So I thought I would just conclude with 4 points, and that you know, with luck and a fair wind, you may be able to be holding my 4 points about culture and simulation. 1, which is probably rather obvious. Simulation activities, especially those involving teams of people, not just maybe an individual working with a particular part trainer, but when you are working in teams, can certainly attempt to influence the behaviours that can change the culture. This is changing the culture back in the workplace. And I don't know how many of you as simulator instructors see yourselves as having this role in shaping behaviours that are ultimately going to, hopefully, if the culture is supportive back in the organisation, facilitate that. But there is this question, when you're trying to change behaviour, what is the culture like back in the units that people are going to go back and work in? And you might want to look and see, are there any culture measurements there? Things you might want to take into account when you're designing your simulation. So that's my first point. The simulator can be used, I think, very effectively as a device for cultural change, not on its own, but as part of a package of measures.